My name is Dr. Patrick Treacy, I'm MD of Aylesbury Clinics, and the lecture I'm going to talk about is complications of dermal fillers, both their diagnosis and management. You know, this is a topic that's of importance because we're seeing complications go up. We're not sure necessarily whether it's because more people are coming into the marketplace or possibly it's the introduction of lignocaine into a lot of fillers, causing the vessels to vasodilate, and as a consequence, the rate of embolism possibly is increasing, we consider. Thankfully, most problems are very minor, and we know that soft tissue augmentation by dermal fillers is increasing almost in an exponential fashion, and this is from the American Academy of Aesthetic Plastic Surgeons, and we see each year that the amount of dermal fillers being used are more and more. Most people have realized that the best fillers to use are the ones that are approved by the FDA. Unfortunately, in Europe and probably in Russia also, we had a situation where all our patients were being used as guinea pigs, and at one stage in Britain and Ireland we had as many as 168 different fillers on the market when America only had 4. Thankfully, as we reach 15 years into fillers now, we have a situation where most of the fillers that we use are safe, reliable, and mostly reversible. I'll quickly run through this because we only have 15 minutes, but I'm going to come back to this. If you have an accidental intraarterial injection, the sort of things that will happen will be you'll get blanching, you'll get this livido pattern, blue-black discoloration, blister or bulla, and then unfortunately skin necrosis. And I'll show you some examples, and some of them have happened very recently. As I said, most of the problems are very simple. This is just localized swelling, a little bit of steroids, dexamethasone. This is gone in 2 or 3 days. This happened to me, believe it or not, in 2001. This is one of my own photographs, and this girl was going to get married within 4 days. And she was fine, and believe it or not, that happened with Restylane, and it's never happened to me since, but this is what happens. This patient here, you're going to get bruising, and bruising, I suppose you can minimize it yourself by telling the patient not to take things like omega fish oils, vitamin E in any one of its forms, be it cod liver oil, be it the omega fish oils, any of the things that sort of people like in terms of. Most of the problems happen as a consequence either of the doctor himself, either he injects too deep in the wrong location, the product, and by God, over the last couple of years we had some terrible products. Inflammation, as you know, you can set up giant cell or granulomas. Infection, biofilm is happening more and more, and I'll show you some examples of that. And then vascular problems. Vascular problems are the ones that you want to watch out for. The hyaluronic acids, in general, tend to be safe, but we know recently they're adding BDDD, and as a consequence of that, these plasticizers tend to give us products, I suppose, that you can use in different areas of the face. And that in itself is good, but sometimes, and I'm not just isolating this company, every one of the companies now have their own I suppose hyaluronics with different cross-link patterns, with different amount of BDDEs, and as a consequence, the wrong product in the wrong place certainly can cause a lot of problems. This is a paper that I wrote recently on a product which has been pulled off the market, Biofilm. I was speaking in Russia about 2 years ago, and I had to see some patients there that had a lot of these problems, and some of the pictures are from there, and this is a paper that I wrote on it. Bio in blue was one of the polyalkamides, the same as bioalkamide, and this is the sort of problems that it caused. This is a product also that came, I think, from Russia. I'm sorry, I don't seem to be blaming Russia, Elena, but Riofil, it was used, it caused horrendous infection type problems later on, as did bioalkamide. I seen a patient only last Sunday that had bioalkamide injected in their face many years ago. 10 years later, it caused a problem, and I'll show you that. Radiesse, as you know, should never be injected into a lip, and you're going to get product migration. This is a famous case of somebody put Radiesse into this singer's lip, and it had to be taken out. Bioalchemid, this is the way it comes out of the face. It looks pretty horrendous. Arterial necrosis, this can happen quite easily. As you know, the labial artery runs on the posterior margin of the wet-dry superficially, and if you hit that, that's what you're going to get. So you need to be well aware of that. Again, this is a patient of my own. I was doing a paper for Prime magazine on atrophic scarring. Sorry, I redid that one in Prime. This is back in 2006. And the patient, I have had his photographs there quite innocently, had some scars, atrophic scars injected with Radiesse, and it hit one of the vessels. And you can see the progression over a period of days. And this patient recovered fully. This is a patient that was referred to me in Dublin with Radiesse injected. Now be careful if you're going into an area near the alar artery. If you're using hyaluronic acid fillers, you can reverse it. Now I'll show you how to reverse it. And within 24 hours, most of these can be fully reversed. If you're using something like Radiesse, and I'm not against Radiesse, it's a wonderful product in its right place, you're on a highway probably to nowhere in terms of trying to salvage your patient. This is a patient I've seen. I've got a lot of patients referred to me from London with almost cartoon-esque figures. When we MRI their face, you can see the substantial amount of encapsulation from the high cross-linked hyaluronic acid fillers. That was Voluma from Juvederm, Subcu, I don't want to mention the companies. And you can see on the bottom picture where I've started on one side and reversed it totally, and then I start on the other side. And I was using dexamethasone, Hyalase, and he got a little bit of 5-fluorouracil, but he sort of had a reaction to that. Biofilm starts like this. You get an initial attachment, you get maturation of the phase, and then it will disperse. So you can inject in one place, the patient gets an infection, and then everywhere in the face where the patient has had the fillers, biofilm will start off. This is a patient that I've seen just since Christmas. She was actually sent to me from one of the hospitals. She was admitted there with bad gastroenteritis. A nurse had injected her face with different hyaluronic acid products, and she blew up like this. Thankfully, as of last week, these are pictures, and I don't want to identify the patient, obviously, and we reversed her with dexamethasone and